Matt, how are you today?
Hello.
My name's Casey. I'm going to
Hi,
do
Casey.
your physical today. Okay, so we're going to just go through all the body systems. I'm going to go ahead and start with your skin. So your skin is it's pink and it's dry. You're kind of tan. I see some macules in your right upper arm area. And there's one on the left upper arm area. The skin is warm to touch on the upper extremities and the lower extremities. There is no edema. I don't see any edema here. The skin turgor is brisk. Very brisk. There is a male hair distribution going on. Let's see what else we got. And I see no varicosities. Okay. And then I'm going to go ahead and look at your nails. The nails are clean and smooth. There is no ridging. The nails are attached to the nail bed firmly. Okay, great. And the same with the toes. All right, there's no opacities. Okay. Capillary refill is brisk. They're less than 3 seconds. All right. Very good. And on the toes as well. The toes and the feet are slightly cooler than the upper body. Okay, and the skin is dry. All right, we're going to go ahead and move on to the hair. Your hair is brown and it's clean. It looks coarse and thick. And it matches the rest of the hair on your body. I don't see any alopecia. I'm going to go ahead and palpate the hair. So, and as I palpate, the hair looks clean, and there's no alopecia, no infestations or seborrhea. All right. Is there any tenderness on your scalp? Okay, and the scalp is freely movable, and there is no crepitus there. Okay, and is there any tenderness in the paranasal cavities at all?
No.
Tenderness there? Okay.
No.
Great. All right. All right, we're going to go to your eyes, and I will start with the inspection. First, the eyebrows. The eyebrows are brown and matching the hair on your head. And the eyebrows are above the outer canthus and symmetrical. And it goes to the lateral side of the outer canthus, and okay, and the eyelashes are upward and outward bounding, and they match your eyebrows. And the parapteral fissures are equal bilaterally. Let's see what else. The conjunctiva is pink and moist, and the sclera is clear with a few vessels there. The irids are blue bilaterally, and the pupils are round and equal bilaterally. The lacrimal sacs and ducts, any tenderness in there?
No.
Okay, great. I'm gonna go ahead and do some eye tests, okay? So what I want you to do is look straight behind me in the wall here, and I'm just gonna check here. All right. And again, great. Okay, now I want you to look at my flashlight behind here, and then keep looking forward, and then, no, keep looking behind, and then I want you to switch to focus to my flashlight now. Okay, let's do that again. So look from behind and stay looking behind, and all of a sudden switch looking forward, great, and then follow it to your nose. Okay, wonderful. Okay, so the pupils are equal, round, and reacted to light and accommodation consensually and bilaterally. Okay, great. I'm going to go ahead and check for corneal clarity. If you could just look straight ahead, and I'm just going to take a look. So the corneas are clear, and there is no evidence of exophthalmos going on there. Okay, wonderful. Next, I'm going to test test for extraocular movements, cranial nerves number 3, 4, and 6, and that is ocular, motor, trochlear abducens. Okay, and how we're going to do that is the 6 cardinal position. So what we're going to do is you're going to look straight ahead, back behind me, and then I want you to follow my flashlight and keep your head still. Okay, so go ahead and go up. You got to follow my flashlight and then down, great, and here, and there, and then down, and then up. Wonderful. Okay, so there is no nystagmus going on there. And I'm going to check for the corneal reflex, so just keep looking ahead and see that the reflex of the eye is equal bilaterally, and that is equal. And one other test for those nerves is the cover-uncover test. So I want you to go ahead and cover this eye with your right hand. Wonderful, and look straight ahead. All right. And then now I want you to look over to the blue drapes and keep your eyes over the blue drapes, and then uncover your hand, your eye. Wonderful. So that was within normal limits as well. Great. Okay. And then the next thing that we would test is the optic nerve, cranial number 2, and that would be with the Snellen's eye test, and you will have already done that, and that is measures for distance, and a normal test would be 20/20, and the lower the fraction goes, it's a poorer result. And then for near vision, we do the Rosenbaum test, and that is a card 16 inches away, or 14 inches away, and a normal test would be 14 out of 14 with that. Okay, great. And then the next test we do for that cranial nerve is the peripheral, is vision by confrontation. So I want you to go ahead and cover your right eye and just stare right at me. And this is the bunny, okay? And I want you to tell me when you see the bunny. Okay, so you look straight ahead, okay, and tell me when you see it.
No.
Okay, great.
No.
Wonderful.
No.
All right.
No.
Okay, great. Okay, and we would do that bilaterally as well, and that was within normal limits. Okay. I just remembered another test that I should have done, and that was for the face, the sensory test. So we'll go ahead and do that. That is testing for trigeminal cranial nerve number 5. Okay, and that will be this will be soft, and this will be sharp. And I want your eyes to be closed, and then tell me if it's soft or sharp. Okay.
Soft. Sharp.
Great.
Soft. Sharp.
Wonderful. Wonderful. And I remember another test that we need to do as well. It is the TMJ test. And so that would be to test the jaw area. Is there any tenderness here?
No.
Okay. So can you go ahead and open your jaw as wide as you can, right? And then clench as hard as you can, and then side to side like that. Wonderful. Okay, and then can you protrude your chin out? Okay, wonderful. And then on palm resistance, do it out. Okay, great. So there wasn't any clicks or crepitus going on there. Okay, and then cranial nerve number 7, facial gymnastics. Got to do that one as well. So what I want you to do is smile with no teeth, and then with teeth. Okay, great. And then frown, pursed lips, puffy cheeks. Okay, tongue to the side. Okay, and I want you to close your eyes, raise your eyebrows, close your eyes completely, raise your eyebrows, and then I want you to try to close your eyes as I open your eyes. Close. Okay, wonderful. Awesome. Okay. All right. I think that was it for the face. Okay, we'll go back to the eye now. Okay, so the eye test, we just did the cover test. All right, now we will do the eye exam test. Back to the optic nerve, cranial nerve number 2, and the optic exam. So this is where I turn the lights off to look for the red reflex, but we'll leave the lights on for now. And just look straight ahead behind me. Okay. Okay, look straight ahead. And I would see the red reflex about here. Wonderful. Okay, then I'm going to go and look inside your eye. Okay. Okay, wonderful. Okay, so what I saw there was the fundus, and it was a creamy yellow color, and there was I saw arterioles and venules going on there. The arterioles are brighter, and they are at a ratio between 2 to 3 or 3 to 5, and then as I was looking at those venules, or arterioles, I went nasally and saw the optic disc, and it was in the shape of a frisbee, and the diameter was 1.5 millimeters, and there was no physiological cupping or glaucomatose. And then as I went a little bit to the left, I found the macula densa, and then which was like a grayish color that was not vascular. In the middle, that was the central furbalis, the central vision. And I saw no vessel nicking or crossing going on there. All right, I think that's it there. Okay, great. Also, when I look at the eyes, I see no exudate going on, no drainage going on there. Okay, we're gonna go ahead and go to, look at the ears. The ears are situated, on the face, symmetrically. The upper part of the ear is at the same level as the eyebrows. I see no lesions on the ears, okay? And in the helix, as I rebound the helix area, it rebounds briskly. Okay. Is there any pain here in the mastoid process area? Pain there? Okay. All right. All right, I'm gonna go ahead and take a look inside your ear. Okay. Okay, wonderful. Okay, so I'm gonna take a look here. And I'm looking in the external canal. I see some hair and some cerebellum. And the tympanic membrane is a pearly gray. And this is the left ear, so I see the cone of light at 7 o'clock. And I see the umbo and the radius. And then I see the partenza below and the paraflaccida above. And the tympanic membrane is a pearly gray. All right. And that is cranial nerve number 8, vestibular cochlear or auditory. All right. Oh, well, that's the test that we're gonna do next. That will test the auditory test. Okay, so we'll go ahead and do those hearing tests. The first one is the Weber test. And what I'm gonna do is I'm going to hit this, and I want you to tell me if you hear in both ears, your right or left ear, or not at all. Okay? Okay, so here we go. Both ears? Both ears? Okay, wonderful. Okay. And the next test is the Rhines test. And what I'm going to do is I'm going to put this in the back of your ear, and I want you to tell me if you hear it, and then tell me when it stops. All right? So, here I go. Wait.
Yes, I hear it.
Okay, tell me when it stops.
Now.
Okay, can you still hear it?
Oh, yeah, now.
All right, now tell me when it stops.
Maybe now.
Okay, great. So perfect. So that shows that air conduction is greater than bone conduction. Can't remember the ratio of that, but great. And the other test I want to do is the whisper test. So can you close this ear? Close that with one ear, and then I'm going to whisper something to you, and I want you to tell me what it is that you hear.
Soccer, tennis, baseball.
That's right. And then I would do that bilaterally as well. Okay, great. Okay, now I'm gonna do your nose. Look at your nose. Okay, on inspection, the nose is midline and symmetrical. The nares are symmetrical. The skin matches the rest of the body. There isn't any macules there of any sort. Is there any pain
No.
here? Okay. When I do this, any pain? Okay, great. And then I'm gonna go ahead and inspect the nose and the mucosa. The mucosa is moist and pink. The septum is midline, and there's no deviated septum or perforation. And I see can you tilt your head back a little bit? I see the inferior turbinates, but I cannot see the superior turbinates. Can you go ahead and show me that you can breathe through each nostril? Okay. Oh, good one. Okay, wonderful. Okay, so I'm going to go ahead and test cranial nerve number 1, olfactory. All right, and it's a smelling test. So you just show me how you can breathe through each NURS. So what I want you to do is close your eyes and cover one NURS for me. Okay, and I want you to tell me what smell it is that you smell. Okay. Okay, go ahead, smell.
Cinnamon.
That's right. Wonderful. Now cover your other NURS and keep your eyes closed and tell me what it is that you smell. Okay, now.
Vinegar.
Yes. Very good. All right. Great. Okay, and next we're going to do the mouth. The lips are pink and the vermilion borders are distinct. They're dry and with symmetrical. Can you smile with me? Show the teeth. The teeth are clean and white. All right. I'm going to go ahead and put on some gloves. If you could go ahead and open your mouth, I'm going to go ahead and count your teeth. So, all right, so you have 27 teeth there. I see, can you keep opening for me? I see a filling in the right lower area and in one in the very far back. I don't see any wisdom teeth there. Did you get your wisdom teeth removed? Okay. Okay, let me see your gums here. Okay, gums are not receding. They seem firm. There's one ulcer here on the left bottom area. Does that hurt right in there?
Mm-hmm.
Yeah. They're pink. They're moist. Okay. All right. I'm going to take a look at, see your frenulum here. You have one up here. Yeah, there's a superior frenulum. Inferior, can you show me? Lift up your tongue. Okay, great. And there's a sublingual one. Down. The buccal mucosa is moist and pink. Okay, great. Can you open up for me? The Wharton's duct is palpable without any calcifications. And the Stenton's duct, which is over by the molars, is palpable and no calcifications there. There's no other ulcers on the buccal mucosa area there. Okay. Can I take a look underneath the tongue again? Okay, it's well vasculated. Can you move your tongue side to side? Okay, great. That's cranial nerve number 12, hypoglossal. Great. All right, I'm going to take a look at your tonsils here. Stick your tongue right out. Okay, and I want you to say ah. I'm going to do it a little further back, tongue way out. Go, There we go, great. Okay, so I see the tonsil well, actually, there is no tonsils, because you got your tonsils removed. But,
True.
I see, the sides there, I don't see any infection. I see, the uvular midline moving up and down as well as the soft palate. Let me take a feel of the roof of your mouth. The hard palate is well rugate and is connected to the soft palate. All right, wonderful. And the tongue, show me your tongue again. Great. It's well papillated and it's smooth on the sides and pink. And it's all pink inside. The rise and fall of the uvula and soft palate, as well as swallow, speech, and gag, is testing cranial nerve number 9 and 10, and that is glossopharyngeal and vagus nerves. Okay, I think that's it for mouth. Okay, great. All right, we're gonna go ahead and do the neck. The head is neurocephalic atraumatic. It's midline. I see no tics or movements, involuntary movements going on. The neck, it looks symmetrical and looks midline as well. Can you go ahead and swallow for me? Okay, great. So the trachea rises and falls and it remains midline as well. And I'm going to go ahead and palpate, and could you go ahead and swallow again? Okay, great, and it remains midline. Wonderful. I cannot see, I don't see any masses or bulges, and I'm not able to inspect the thyroid. But what I'm going to do now is I'm going to palpate the lymph nodes. Okay, so this is preauricular, postauricular, occipital, the retropharyngeal, the submandibular, and the submental. Okay, and we have the inferior cervical chain, the posterior cervical chain, the deep cervical chain, and the subclavicular going on there. And I don't feel any, is there any tenderness there when I did that? Okay, so I do not feel any lymph nodes palpable there. I'm going to go ahead and test cranial nerve number 11, vagus nerve shoulder shrug. So can you put your shoulders up? Okay, and then shoulders down. All right, and can you do it on resistance? Okay, wonderful. Okay, and then I want you to go ahead and do flexion. Okay, extension, hyperextension. Okay, wonderful, hyperextension. Okay. Can you do lateral side to side? Lateral side to side. Okay, and then rotation side to side. Okay, wonderful. Can we do that all with resistance? So do forward and then back. Okay, and then side, and then rotation. Rotation. Great. Okay, good. I'm going to go ahead and palpate your thyroid. So, can you turn over towards the face, more towards the curtains for me? Straight ahead. We go forward a little bit. So we're gonna. Okay, great. Okay, so I'm going to go ahead and feel for the thyroid. I want you to put your head forward a little bit and then go to the right. Right? Wait, put your head back a little bit more. Okay, and then to the right. Okay, great. And I'm going to start to feel the thyroid. Okay, I think I feel it. Okay, so there's no nodules or any calcifications there. All right, and I want you to go the other side. No, so go lateral bendingly. No, not rotate. Yes, there you go. All right, I'm gonna go ahead and feel, and I feel no nodules or calcifications there. Okay, great. I'm feeling for the spinous cervical process and the paravertebral muscles. Any tenderness in there? Okay, great. All right, can you go ahead and turn back towards me? I'm going to go ahead and auscultate for the thyroid, and I'm going to use the bell. Can you go ahead and hold your breath for me? Okay, you can breathe again. All right, take a deep breath in and breathe again. Okay, so there is no murmurs or bruits there. I see no evidence of JVD. I see some pulsations. And I think that is it for the neck. We're going to go ahead to the lungs. Can you go ahead and take your shirt off, and I'm going to go ahead and pan the room. So they're showing, go ahead and take your shirt off, and I'm going to show that there's no notes anywhere. None on the wall, none at my little station, nothing here. Nothing. Okay. Okay. Yeah. Okay. Okay, so let's go ahead and do lung inspection. I see visible respirations. I see some pulsations. The anterior posterior diameter is half the width as the transverse diameter. Okay. I'm going to go ahead and palpate here. Any tenderness?
No.
Okay. And the skin, I see some macules, one here on the left upper arm. There's a male hair pattern going on. And I'm going to go ahead and auscultate the chest for lung sounds. Okay. Why don't you go ahead and just breathe normally. Okay. Sorry, what I want to do first is, can you go ahead and face towards this way?
Sitting?
Yeah, stay sitting and firm. Okay. I'm going to go ahead and measure for diaphragmatic expansion. So go ahead and go ahead and take a deep breath now. Okay, great. So that was symmetrical. Wonderful. And then another thing I'm going to do is measure diaphragm. See, that was thoracic expansion. Now I'm going to do diaphragm excursion. Okay, so I want you to move, lean forward a little bit with your arms crossed. Okay, and I want you to take a deep breath in and hold it. Okay, great. Then you can let go. And then I want you to take a deep breath in and then a deep breath out. Deep breath out. Okay? And then hold it. With it out. Okay. Oh, my pen is not working. Okay, and I'm going to go ahead and measure that. And that is 2 centimeters. 4 centimeters, and normal is 3 to 5 centimeters. Okay, great. I'm going to go ahead and percuss. Okay, and then I'm going to do tactile fremitus, and I want you to tell me, I want you to say 99 as I put my hands on your back, okay? Say
99, 99, 99, 99, 99, 99.
Okay, so it's bilaterally, vibrations felt bilaterally. Okay, I'm going to go ahead and oscillate. You just breathe normally. Okay, and then could you put your hands above your head? Put them on your head. Okay, and I'm just going to go ahead and breathe normal. Okay, wonderful. And on this side. Okay, wonderful. Then I'm going to do the front. You can turn towards me. And I'm going to take a listen to the breath sounds in the front. Can you relax your hands for me? Okay, so lung sounds are clear. There's no abnormal lung sounds going on there. Okay, we're going to go ahead and listen, deal with the heart on inspection. I see some pulsation on palpation. They're on the 5th clavicular line, 5th mid-clavicular line, 5th intercostal space. Okay, so is the PMI, and I can feel pulsation there, and then on Erb's point, and the pulmonic and the aortic, I'm not feeling any murmurs. Okay, any tenderness?
No.
All right. All right, go ahead and lay down. Put your head on this side. Go flat on your back. Okay, wonderful. And I'm going to take a listen to your heart sounds. I'm first going to do the apical pulse, which is mid-clavicular line, 5th intercostal space. Okay, there. First with my diaphragm, and then for the bell. Okay, great. And then now I'm going to do, listen to the tricuspid, and that will be the 4th intercostal space, left sternal border. And then with the bell. And then I would the third intercostal space, left sternal border. It will be the pulmonic. Oh, I'm sorry. I'm sorry. Its tricuspid is fourth intercostal space, left sternal border, and then its Erb's point is third intercostal space, left sternal border. And then we have the pulmonic, at the second intercostal space, left sternal border. And then we have the aortic. Okay, so I heard the S1 sounds more on the apical and on the tricuspid, and heard S2 greater on the pulmonic and the aortic valves. I heard no bruits or murmurs and no S3 or S4 sounds. Okay, great. Now I'm just going to feel for your pulses. So we got the temporal pulse, the carotid, the brachial, and the radial. I'm going to defer the femoral. We got the popliteal, and your feet not all the way, just a little bit. Okay, great. Okay, wonderful. And then the posterior tibial pulse and the dorsal pedalis pulse. And they're all strong and no thready or irregularities there. Okay, great. And I'm going to go ahead and listen to the carotids with the bell. And the temporal. And there is no bruise going on there. Okay, then we're going to go ahead and go to the abdomen. The abdomen is slightly round. There is male hair distribution. There is an inverted umbilicus and a negative colon sign. I'm going to go ahead and auscultate your bowel sounds in all four quadrants. Okay, and they're active in all four quadrants, 5 to 30 per minute. Okay, and I'm going to go ahead and auscultate over the liver. And the spleen. And there is no friction rubs going on there. And now I'm going to auscultate the arteries. So first I'm going to do the aorta. It's right or left of the midline. Okay. And then the renals. And then the iliacs. is no bruise there. Any tenderness? Any of these quadrants? Oh wait, no, I'm gonna do percussion next, okay? Okay, and there is tympani sound, all in 4 quadrants, except over the bladder area, which is dull. Okay. Alright, great. Now we're gonna palpate. Any tenderness? Oh no, wait, we're gonna percuss for the liver. Okay, so, Matt, are you still with me there?
Yep.
Okay, so I'm gonna go ahead and, percuss for the, for placement of the liver, and go ahead. Okay, here. And then start up. All right there. Okay, and then I measure that. And that is about 6 centimeters, and that is within the normal range of what was it, 6 to 12, I think. Okay, great. I'm gonna go ahead and palpate, which we did. No tenderness. Okay, I'm gonna do a little bit deeper. Okay, I feel no masses. Any tenderness when I did that? Okay, no masses or bulges, and there's no evidence of allotment, and I see no ascites going on there. Okay, I'm gonna feel for your liver, Matt. Okay, so I want you to take a deep breath. Okay, and I'm gonna kind of feel from below. Hold your breath for me. Okay, so I feel the edge of the liver there, and the margins are smooth, and I don't feel any calcifications or nodules there. All right. And then percuss for the spleen. Forgot to do that. And I only hear dullness in the intercostal spaces, and I hear resonance in the costal area, and only tympani below. So that makes me think that the spleen is tucked underneath, and I will not be able to palpate the spleen. Matt,
Yeah.
stay with me here. Okay. So I think that could be it for the abdomen. Trying to think. Yeah, I think that's it. Okay, we're gonna go ahead and do some exercises now to test your musculoskeletal. So first we're gonna do the hip. So I want you to go ahead and flex your leg, press it up, and then down. Okay? And I want you to do that on resistance. So up, and then down. Okay, great. And then I want you to do abduction, which is away from your body. I'm sorry. Wait, this way. This way. Okay, and then in, which is add, and then crossover, and that's abduction. Great. Okay, I want you to do internal rotation. So touch your knee to knee. Great. And then your ankle to your knee. And that's external rotation. Wonderful. Okay. I want you to do on resistance, the abduction, resistance, and then abduction and resistance. Excellent. Okay. Excuse me. Okay, let's do the knee. Okay, put your leg up. Matt, can you watch for me?
Yeah.
What you're doing? Okay, so put your leg up and then bend your knee. Okay, so that's flexion, and then this is your knee we're doing, and extension. Okay, thank you. Okay, now do that on resistance. Go down. Okay, and then your knee up. Great on resistance. Wonderful. Okay, now we're gonna do plantar flexion. So point your toes. Okay, and then dorsal flexion. Point up. Sorry. Okay, now do it on resistance. Okay, and then back again. All right. And then I want you to do inversion. So can you move your foot in? Great. And then your foot out. Okay, wonderful. And I'm going to hold your foot, and can you rotate your ankle? Rotate in circles. Okay, wonderful. Okay. Okay, so we would do that bilaterally. Wonderful. Okay, Matt, can you come and sit up for me? Can you go ahead and cross your leg for me? Okay, that's testing the glutes, the quads, and the hamstrings. All right, good job. Okay, now can you go ahead and stand for me? And you can put your shirt back on. Great. Okay, and I want you to hyperflex your hip. So put your leg behind you. Okay, let that all right, so we do that bilaterally as well. Okay, good. Okay, now look towards me. We're gonna go ahead and do our shoulder. Okay, so we're gonna flex our shoulder. Okay, and then we're going to extend. Okay, hyperextend, back. Okay, wonderful. And then we're gonna do abduction, cross over. Okay, great. We're gonna do that with resistance. So if you can move your arm forward, and then back, back, okay. And then do abduction, arms out, okay, arms down, back in. Okay, great. Okay, we're going to do internal rotation, which is arms behind you. Okay, that's internal rotation of the shoulder. And then external is arms behind your leg. Sorry, watch out for the fan. As if you're outside the police car. Okay, and then put that down. Okay, great. Now we're going to do the arms. We're going to do flex the arms and then flex down. Okay, just do that on resistance. Up and then down. Okay, can you do supination and pronation? Okay, great. Okay, now we'll do the wrists. Can you do flexion, extension? Use the wrists, not your fingers. No. Okay. Okay. Flexion, extension, no finger moving, just your wrists. Okay, hyperextension. Okay, great. We're gonna do radial deviation, ulnar deviation. Okay, great. I want you to do that on resistance. So up, flex with your wrist. Okay, then down. Okay, wonderful. Okay, now we're gonna do fingers. So I want you to flex fingers. Don't do fists, just flex down. Okay, then extend, then hyperextend. Okay, I want you to do that with resistance. So extend, flex, and then extend. Great. Okay, I want you to do abduction of the fingers. Adduction, crossover. Okay, great. I want you to try to open them. Open your fingers. Open them as I do that. Okay, great. Oh, open your fingers nice and wide, and now try to squeeze them. Okay, wonderful. Okay, can you squeeze my fingers as hard as you can? Okay, grips are equal bilaterally. Wonderful. Okay, and I want you to do opposition. Touch all your fingers tips to the thumb. Okay, and then to the base of your pinky. Okay, great. And Now we'll do the torso. Can you go ahead and touch your toes?
No.
Okay, great. And I check for scoliosis. Okay, that looks good. All right, now stand up. And we're gonna do lateral bending. Back and forth. Okay, and then hyperextend back, and going down was flexion, standing up was extension. Okay, and we already did the neck earlier. Did shoulder shrug already. Okay, great. Now we're gonna do neurological. Okay, can you go ahead and walk normally towards the camera, just normally? Okay, great. Now walk back, heel to toe. Okay, all the way. Okay, good. Okay, turn around to face the camera. Can you go ahead and touch your head, the bottom of your foot, all the way down your leg? Okay, great. We do that on both sides. And then we're going to do rapid movements with our hands, supination, pronation, as fast as you can. Like this. Okay, wonderful. Okay, can you look at me, and can you put your arms out and touch your fingers to your nose, back and forth? Can you do that with your eyes closed now? Can you do it now? Be normal, please. Okay. All right, that's it. That's great. Okay, open your eyes and put your hands to your side. All right, and I want you to close your eyes and let's see if you can have a negative Romberg's test. Okay, open your eyes. Okay, that's a negative Romberg's test. Let's see. Okay, you can go ahead and sit down. Okay, and we're going to do a few tests. This is going to be the paint and point test. Okay, and this will be sharp. Those will be sharp, and this will be dull. Okay, and I want you, as I am putting it on either your arm or leg, I want you, don't cross your legs, honey. There you go. I want you to point and tell me what it is, and if it's dull, say if it's dull or sharp, and point and tell me where it is with your eyes closed. Okay? So, eyes closed. What is it?
Sharp.
Where's that?
Upper right arm.
Okay. Here.
Dull, lower right left arm. Sharp, lower left leg.
Okay, great. And we do that bilaterally, upper, lower, and even on the core. Okay, wonderful. Next, we are going to do the vibration test. And what I'm going to do is I'm going to do this, and I'm going to put it on a joint, and I want you to tell me if you feel it and tell me when it stops. Okay? And I need you to close your eyes. Okay? Feel that?
Yes, I feel it.
Tell me when it stops.
No.
Okay, that was a little delayed.
Oh, okay. I thought it was.
Let's try that again. Okay.
It stopped really
Eyes
quick,
closed.
actually. Okay. Yes, I feel it. Stop.
Great. Let's do one more joint. Eyes closed.
Yes, I feel it. Stop.
Okay. All right.
Oh,
Okay, so that's the vibration test. I'm going to go ahead and do the position test. So let me see your fingers. This will be up, neutral, and down. Okay, and I'm going to do a finger and a toe, and with your eyes closed. So go ahead and it's okay. Go ahead and keep your eyes closed.
Okay.
And I want you to tell me if it's up or down or neutral.
Up.
Okay. Here.
Down.
Okay, and the toe.
Down.
No. Up. Okay. And then one more.
Neutral.
Great. Perfect. Let me stop that. That alarm. Can't stop it. Okay. Okay, next. What else did I get? Oh, I'm gonna do sternocleidosis. And that is, I'm gonna put something in your hand and I want you to tell me what it is that you feel. Can you open